My name is Sarah Haag, and I'm a doctor of physical therapy and the author of Understanding and Treating Incontinence. I would like to share the 5 things that I wish everybody knew about urinary incontinence. Number 1, urinary incontinence is common, but not normal. What I mean when I say that is that the statistics show that many people have to deal with incontinence at some point in their life. However, we need to acknowledge that while very common, that's not a system working normally. So there is the possibility of restoring that function and that continence, because ultimately continence is normal. Number 2, if it matters to you, it matters. Too often urinary incontinence is trivialized or normalized as not that big of a deal. However, I really want people to know that if urinary incontinence is impacting your life negatively in any way, you should get help for it, even if the first people you mention it to indicate it's not worth it. Number 3, there is no magic cure for urinary incontinence. So there are a lot of different ways to approach urinary incontinence and a lot of different ways to address it and hopefully eliminate it, cure it. However, that answer is going to depend 100% upon you. So finding out the reasons why the incontinence is happening and creating a plan that addresses those issues for you is going to be your magic answer. Number 4, drinking less water may be unhelpful if you're trying to manage your incontinence. It seems to make sense just from an input-output standpoint that if I were to drink less water, less fluid would need to be excreted. However, we need a certain amount of water in order for our bodies to function normally. So when people start to reduce their water intake, what happens is that the urine becomes more concentrated, which may be irritating, but also people can develop constipation, which can increase urinary symptoms as well. So less water is not usually very helpful if you're experiencing incontinence. And then number 5, if people walked away from this video with knowing just one thing, there is help and it can get better. So working out a plan for you, understanding that it is not something that you have to suffer with, is paramount in taking that first step to actually getting treatment and hopefully curing your incontinence. So if you'd like to read more about different types of incontinence and different ways that you might be able to help address it, you can read my book, or you can make an appointment with your physician or a pelvic floor physical therapist for a full assessment and an individualized plan.